Diabetes does not automatically end your career behind the wheel, but it does mean the DOT physical process looks a little different for you, and knowing what to expect before you walk into that exam room can make a real difference. Here is the basic breakdown. The FMCSA, that is the Federal Motor Carrier Safety Administration, sets the medical standards for all commercial drivers under federal regulations. How your diabetes is managed determines which path you take towards certification. If you have type 2 diabetes and you are managing it with diet, exercise, or oral medications, you go through the standard DOT physical. The medical examiner reviews your overall health, checks for complications, and makes a determination. Well-controlled blood sugar and no disqualifying complications? Many drivers in that category get certified the usual way. If you use insulin, whether that is type 1 diabetes or insulin-dependent type 2, the process involves more steps. Historically, insulin-treated drivers were barred from interstate commerce entirely. That changed in 2018 when the FMCSA launched the Insulin-Treated Diabetes Mellitus Exemption Program, known as the ITDM exemption. This program gives insulin-treated drivers a formal pathway to drive across state lines, provided their condition is well managed and documented. Applying for that exemption means showing your diabetes is stable, that your treating physician supports your ability to drive safely, and that you have not had frequent severe low blood sugar episodes. The exemption requires ongoing monitoring and periodic renewal. It is not a one-time paperwork fix. It is an ongoing commitment to documentation and oversight. Now, regardless of which category you fall into, the medical examiner during your DOT physical is going to look at several things closely. Cardiovascular health, because diabetes raises heart disease risk. Vision, because diabetic eye complications are a real concern and drivers have to meet minimum vision standards. Nerve function, because peripheral neuropathy, that numbness or loss of sensation in the hands and feet, can affect your ability to operate a vehicle safely. Kidney function, and your history with low blood sugar episodes, especially if you use insulin. The single best thing you can do to prepare is show up organized. Bring your current medication list with dosages. Bring recent lab work, especially your A1C result. If you have seen a specialist, an eye doctor, a cardiologist, an endocrinologist, bring those records too. Be upfront with the examiner about your full history. Withholding information about your diabetes or your medications can create serious problems down the road. Before your exam, talk to your own clinician or a DOT-certified medical examiner about where you stand. If you are pursuing the ITDM exemption, work with someone who knows that process well. Going in prepared is the move that keeps your medical card and your career on solid ground.